most surgeons don't think about physical therapy. They go in and they do their thing, sew them up, okay, no infection, out the door you go. They don't, it's just not in their train of thought or their plan of care in terms of what they would do. If women know to ask for physical therapy, and if the surgeon is in tune enough to say, I want you to see this physical therapist before we start, so that the physical therapist has an opportunity to get some baseline measurements. Because the reality is, the person that you are at the time of diagnosis is not going to be the person that you are at the end of the experience. Lots of changes are going to occur, lots of changes that are going to be amenable to physical therapy. And so we want to be a part of that team, because we know that after the surgical oncologist excises what they need to take out, there are going to be scars to deal with, tissue changes to deal with, potential swelling in the arm to deal with. I want to see somebody before surgery. I want somebody to know what they have to do following a lumpectomy, or following a breast conservation surgery, or following a mastectomy. You need to be mindful and aware that that arm has got to move. The physical therapist has the training and the expertise and the experience to know we're not going to do something that's going to rip open an incision, but we're going to do something that is progressively going to allow that arm to elevate. We're going to do something that makes sure that the neck turns, both in every direction that it's supposed to go. We're going to make sure that that your cardiovascular stamina is where it needs to be. Not very many surgeons say, get out of bed, day 2, day 3, get outside. Walk for half an hour, walk for an hour, walk for a mile, get to 2 miles, get to 3 miles. If you have a physical therapist who has seen you prior to all this happening, we can tell you, yeah, it's pretty realistic for you to think about going and starting an exercise program as soon as the post-operative things have been taken care of. Now, it's difficult at times to walk when you have drains in. They're uncomfortable, but there are ways to walk and do that. We need to be available to use all of the things that we know as physical therapists, because again, that breast is just not a breast. It is part of an entire body that needs to move. And if this entire upper quadrant stops moving, then the neck stops working correctly, then the thoracic spine stops working correctly. Then it just cascades into one thing after another. So, the philosophy at this clinic has always been making movement better. We make movement better for people who have back pain, neck pain, mastectomies, complications from radiation fibrosis, any of those sorts of things. So it really, in some ways, it's a new population for us, but it doesn't change what we've always done, which is to come up with creative problem-solving solutions to make movement better.